Bismillahirrahmanirrahim. This video is about the nomenclature that is used in skin disorder. These are the references for this video. Dermatosis is a common term that is applied to any skin disorder. There is use of many macroscopic terms that describe a certain morphology of a lesion, especially in skin disorders. Macule stands for a circumscribed lesion that is of less than 5 millimeter in diameter, and it is characterized by flatness, and usually it is discolored, often red in color. Then there is another condition that is patch, and this patch is the circumscribed lesion of more than 5 millimeter in diameter, and this is also flat and discolored. Then papule is a condition that is characterized by elevated dome-shaped or flat top lesion that is less than 5 millimeter across, while the nodule is elevated lesion that is spherical in contour and it is more than 5 millimeter across. The plaque is another morphological lesion that describes an elevated flat top lesion usually more than 5 mm across, and it is maybe caused by coalescence of many papules. The vesicle is a fluid-filled raised lesion that is less than 5 millimeter across. Then there is another term that is bulla, and it is fluid-filled raised lesion more than 5 millimeter across. There is another term blister that is commonly used for vesicle or bulla. Pustules are the discrete pus-filled raised lesions. Wheals are itchy, transient, elevated lesion with variable blanching and erythema formed as a result of dermal edema. Then scale. Scale is dry, horny, plate-like excrescences, usually the result of imperfect cornification or keratinization. Lichenification is the term which is used to describe thickened and rough skin that is characterized by prominent skin markings. Usually it is the result of repeated rubbing in susceptible persons. Excoriation are the traumatic lesion characterized by breakage of the epidermis caused by raw linear area that is a deep scratch. Onycholysis. Onycholysis is the separation of nail plate from the nail bed. Splinter hemorrhage of all 10 fingers are present in this picture. Similarly, some terms are microscopic and they describe specific microscopic morphology. Hyperkeratosis is described as thickening of the stratum corneum, often associated with qualitative abnormality of the keratin. This picture photomicrograph is showing hyperkeratosis, parakeratosis, and also there is slight dysplasia. What is parakeratosis? Parakeratosis, it is characterized by the retention of the nuclei in the stratum corneum. The mucous membrane normally shows parakeratosis. Then hypergranulosis is hyperplasia of the stratum granulosum, and it is often due to intense rubbing. Acanthosis is the diffuse epidermal hyperplasia. Papillomatosis is a term that describes surface elevations that are caused by hyperplasia and enlargement of the contiguous dermal papillae. Dyskeratosis shows It is due to abnormal characterization and occur prematurely within individual cell or group of cell below the stratum granulosum. Generally, these are the same as dysplasia. Acantholysis is the loss of intercellular connection that result in loss of cohesion between keratinocytes. The spongiosis is the edema that is present between the cell of the epidermis. Hydropic swelling or blurring is another term that describes intracellular edema of the keratinocytes. Exocytosis, especially the lymphocytic exocytosis, is infiltration of the epidermis by inflammatory or circulating blood cells, while the erosion describes the discontinuity of the skin exhibiting incomplete loss of the epidermis, and ulceration describes the discontinuity of the skin that exhibit complete loss of the epidermis and often of portion of the dermis and even subcutaneous fat. Vacuolization, as we can see in this micrograph, is showing the formation of the vacuole within or adjacent to the cell. Often refers to the basal cell basement membrane zone area. Lentiginous is another term that describes the linear pattern of melanocytic proliferation within the epidermal basal cell layer. Lentiginous melanocytic hyperplasia can occur as a result of reactive changes or as a part of neoplasm of the melanocyte. Now, classification of skin disorders. The non-neoplastic skin disorders can be categorized as genetic dermatosis, non-infectious inflammatory dermatosis, infectious dermatosis, granulomatous diseases, connective tissue diseases, non-infectious bullous dermatosis, scaling dermatosis, and metabolic skin of diseases. Then the genetic dermatoses include ichthyosis, the ichthyosis vulgaris or common type of the ichthyosis, and sex-linked ichthyosis, keratosis palmaris et plantaris, xeroderma pigmentosum, Darier's disease that is also termed as keratosis follicularis, urticaria pigmentosa, and ataxia telangiectasia. The non-infectious inflammatory dermatoses are dermatitis, urticaria, malaria, and includes malaria crystallina and malaria rubra, paniculitis that includes erythema nodosum and erythema induratum, and acne vulgaris. The infectious dermatoses include impetigo verrucae, and these verrucae are of verrucae vulgaris, verrucae plana, verruca plantaris, epidermodysplasia verruciformis, and condyloma acuminatum, or bilinear wart or anogenital wart. Then molluscum contagiosum, viral exanthemas, and superficial mycosis that includes Tinea capitis, Tinea barbi, Tinea corporis, Tinea cruris, Tinea pediculosis, Ochinomycosis, and Tinea versicolor. The granulomatous disease of the skin include lupus vulgaris, cutaneous sarcoidosis, and granuloma annulare. The connective tissue disorders that are specifically studied with skin are lupus erythematosus, systemic sclerosis, and lichen sclerosis et atrophicum. The non-infectious bullous disorders can be pemphigus, and these include pemphigus vulgaris, vegetans, foliaceus, and erythematosus, pemphigoid, dermatitis herpetiformis, and erythema multiforme. The lichen planus and psoriasis are scaling dermatoses. The metabolic skin diseases are amyloidosis, lipoid proteinosis, porphyria, calcinosis cutis that can be metastatic, dystrophic, idiopathic, subepidermal calcified nodule, then gout, onchronosis, mucinosis, and idiopathic hemochromatosis. Neoplastic lesion of the skin can be divided into epidermal tumor, adnexal tumor, melanocytic tumor, dermal tumors, and tumors of the cell that are migrated to the skin. The epidermal tumors are studied under four subheads: benign tumors, epithelial cyst, pre-malignant lesion, and malignant tumors. The benign tumors of the epidermis are squamous papilloma, seborrheic keratosis, fibroepithelial polyp, and keratocanthoma, while epithelial cysts are epidermal cyst, pilar or trichlemal sebaceous cyst, dermoid cyst, steatocystoma multiplex. The pre-malignant lesions of the skin of the epidermis are solar keratosis, that is also termed as actinic keratosis or senile keratosis, Bowen's disease, xeroderma pigmentosum, and erythroplasia of Curette. The malignant tumors of the epidermis are squamous cell carcinoma, basal cell carcinoma, and metatypical, that is basosquamous carcinoma. The cellular migrant tumor are mycosis fungoides, Langerhans cell histiocytosis, mastocytosis, lymphomas and leukemias, and plasmacytoma. So the skin appendageal tumor are tumors of hair follicle that are trichoepithelioma, that is also named as Brooks tumor, then pilomatrixoma, that is calcifying epithelioma of Malheur, then trichofolliculoma, and tricholimoma. Tumor of the sebaceous glands are nevus sebaceous, sebaceous adenoma, and sebaceous carcinoma, while tumor of the sweat glands are acrine tumors such as acrine poroma and acrine hidradenoma, and acrine spiroadenoma. The tumors of the apocrine tumors of the sweat gland are papillary hidradenoma and cylindroma. That's this cylindroma has another name, that is turban tumor. Then third one is the sweat gland carcinoma. Melanocytic tumor are nevocellular nevi and malignant melanoma. The fourth category of these neoplastic lesion, is dermal tumor, and these include dermatofibroma and malignant fibrous histiocytoma, dermatofibrosarcoma protuberans, xanthomas, lipomas and liposarcoma, leiomyoma and leiomyosarcoma, hemangiomas, lymphangiomas and angiosarcoma, glomangioma, and Kaposi sarcoma. Another way to classify dermatosis is on the basis of pathologic process. One is the disorder of epidermal maturation, and that includes ichthyosis. Another process is acute inflammatory dermatosis, that includes urticaria, acute eczematous dermatitis, and erythema multiforme. Then chronic inflammatory dermatosis includes psoriasis, seborrheic dermatitis, and lichen planus. The blistering disorder of the skin are divided into inflammatory and non-inflammatory categories. The inflammatory include pemphigus, bullous pemphigoid, and dermatitis herpetiformis, while the non-inflammatory includes epidermolysis bullosa and porphyria. The disorders of epidermal appendages include acne vulgaris and rosacea, and paniculitis disorders are erythema nodosum and erythema induratum, and there are many other types of paniculitis. The disorders of pigmentation and melanocytes include freckle, that is also termed as aphilis, lentigo, melanocytic nevus, pigmented nevus, dysplastic nevi, or melanoma. The benign epithelial tumors include seborrheic keratosis, acanthosis nigricans, fibroepithelial polyp, and epithelial or follicular inclusion cyst. Then there are many appendageal tumors or adnexal tumor. The pre-malignant and malignant epidermal conditions are actinic keratosis, squamous cell carcinoma, and basal cell carcinoma. Tumor of the dermis include benign fibrous histiocytoma and dermatofibrosarcoma protuberans. And tumor of cellular migrant to the skins are mycosis fungoides, that is cutaneous T-cell lymphoma, and mastocytosis. This is the classification we will study in our dermatology module.